Lung nodules is a very difficult proposition when people, especially patients, are told in their clinic that their scan is showing a nodule. They get very worried and anxious. Nodules are kind of a small area on the CT scan, which are small kind of opaque area. They could vary from different sizes to 5 millimeters to 30 millimeters in size. If they go above 30 millimeters in size, they're obviously a big lesion. But nodules are kind of in between that range. Now, nodules mostly are benign, so 60% of the nodules that are seen on the CT scan are nothing serious at all. They're scar marks or are previous infection of some sort, but a 40% could be serious and cancerous. So that's why usually interval scanning is required when we see nodules to see if they're growing, especially if people are smokers in the background. And the shape of the nodule is very important. If they're spiculated nodules, then it does suggest a bit of a worry for us. We could have nodules which are part solid and part not solid, and they're also one that we have to be very, very vigilant about. There's some nodules which have calcification, and if they have calcification, they're not usually cancerous, they're usually benign. So the shape and the size of the nodules are important, but the bigger the size, the more worry we have about cancer, because as I have 40% of these nodules could be cancerous, but majority of them, which is about 60%, are benign lesions. So it's difficult once you're told that you have a nodule, and that's why an interval scanning is required to clarify that, because if they're doubling or increasing in size, then they are worrying. Otherwise, they are not. If they remain the same size over a longer period of scanning, then that's good news in a way. But if they're increasing in size, then one has to worry.